David Gillette, it's June 19th, 2015. I'm going to be doing the cranial nerves 1 through 12 examination. How you doing today, patient?
I'm good. How are you?
Good, thanks. All right, good. We're going to begin with cranial nerve 1. So could you cover one of your nostrils for me, please? And inhale. Nice. Now switch sides. Perfect. Inhale. Good. Could you close your eyes for me? And now cover one nostril. And then inhale. Switch sides. Inhale. Can you identify the spell?
It's coffee.
Very good. And was the intensity the same on both sides?
Mm-hmm.
Nice. All right, now we're going to be assessing cranial nerve 2 with the fundoscope. Could you hit the lights for me, please? Could you stare at that the fixed point on the wall right here and just keep your eyes focused on it? Nice. I'm looking for AV nicking, papilledema, and hemorrhage. And they're absent in the right eye. And the left eye is all clear too. So that's a good sign. Could you hit the lights for me again, please? Now we're going to be checking cranial nerves 2. We're still going to be doing cranial nerve 2, but we're going to be doing visual field. So I'm going to be either throwing up a 5, a 1, or a 2, and just let me know what you see. Could you cover one of your eyes for me, please?
1, 2, 5, 5, 2, 1.
Very good. Switch sides.
1, 2, 5.
Okay.
5, 2, 1.
Very good. Now we're going to be doing cranial nerves 2 and 3, so could you hit the lights again, please, for me? We're going to be first doing pupillary fatigue. And I'm just seeing if how quick the pupil fatigues. And his are normal, but an abnormal would be they fatigue very quickly. Nice. Now we're going to be doing direct and consensual. So could you just stay looking straight? Now I'm checking if both pupils constrict, and if I'm shining the light in the right eye and only the right eye constricted but not the left, that'd be a cranial nerve 3 lesion. Then if I was shining it in the right eye and neither pupil constricted, that's a cranial nerve 2 lesion. Could you hit the lights for me, please? Now I'm going to be checking cranial nerve 3 for ptosis, which is absent. And could you close your eyes for me? I'm looking for blepharospasms, which are absent as well. Now we're going to be doing convergence and accommodation. First we're going to start with convergence, so could you just stare at the tip of this pin and follow it all the way in? Very nice. Good. One last time. Very good. Now we're going to be doing accommodation, so I'd like you to stare at this pinpoint when I tell you, and then at that point of the wall. We're going to alternate. So ready? Pin, wall, pin, wall, pin, wall. Very nice. Now I'm going to be assessing cranial nerves 3, 4, and 6. So I'm going to begin by doing the H in space. So if you could, just stay looking at my bottom of my chin and just follow don't look at the bottom of my chin. Follow the tip of my finger and just follow it all the way. During these, we're assessing the extraocular muscles of the eye. Now we're going to be doing the X in space, so continue looking at the tip of my finger and just follow it through. Very nice. Now we're going to be doing cranial nerve 5, and I'm going to be first. Can I see the back of your hand? We're going to be rubbing this on your face. Is that okay?
Mm-hmm.
All right. Could you close your eyes for me? Could you feel that?
Mm-hmm.
Could you feel this?
Mm-hmm.
Was the intensity the same on both sides?
Mm-hmm.
Nice. Can you feel this?
Mm-hmm.
Can you feel this?
Mm-hmm.
Intensity the same on both sides?
Yes, sir.
Can you feel this?
Yep.
Can you feel this?
Yep.
Is the intensity the same on both sides?
Mm-hmm.
Beautiful. Now we're going to be doing light touch because we just assessed crude touch. So could you close your eyes for me again? Can you feel this?
Mm-hmm.
Can you feel this?
Mm-hmm.
Was the intensity the same on both sides?
Yep.
Can you feel this?
Mm-hmm.
Can you feel this?
Mm-hmm.
Was the intensity the same on both sides?
Mm-hmm.
Can you feel this?
Mm-hmm.
Can you feel this?
Mm-hmm.
Was the intensity the same on both sides?
Mm-hmm.
Beautiful. And now we're gonna, could you puff out your cheeks for me? Beautiful. Bite down hard. Feeling the masseters and the temporalis. And also, could you open your mouth? And don't let me close it. Awesome. Now I'm gonna be checking cranial nerve 7. And so I'm gonna be looking at, could you raise your eyebrows for me? Now close your eyelids tightly. Could you smile? And then think of something funny. There we go, I'm a hilarious guy. And now could you also puff out your cheeks? And don't let me blow out there. Beautiful. Now I'm going to be assessing cranial nerve 8, and I'm first be doing a hearing test on them. So could you close your eyes for me? Can you hear this?
Yeah.
Just let me know when the sound disappears.
No.
Can you hear this?
Mm-hmm.
Let me know when it disappears.
No.
Beautiful. And they checked out even on both sides, but if it wasn't, I would perform the Weber test, and whatever side that lateralized to, the louder side, I would perform the Rene test on that ear. First, I'd be doing bone conduction and then air conduction. If air conduction was greater than bone conduction, I know that would be a neurosensory loss on the contralateral side. But if bone conduction was greater than air conduction, I know it would be a conduction loss on the same side. And now we're going to be doing your gait. So could you, if you could come forward, patient, and just walk heel to toe with your eyes open. Beautiful. And now could you turn around and keep with your eyes closed? Do the same thing, heel to toe. Alright, that's good. Could you sit down for me, please? Keep your eyes fixed on that point right there. I'm going to be checking the nystagmus now. And which seem to check out perfectly. Now I'm going to be assessing cranial nerve 9 and 10. So first I'm going to be looking at the palate. Could you open up your mouth and stick your tongue out? Say ah.
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 Perfect. And everything seemed to be fine, but if there was a lesion, it would be pulling towards the strong side, so it would deviate away from the lesion. Now I'm going to be assessing the gag reflex. Could you stick your tongue out for me, please? That's present. And it's a bilateral test of both sides. Beautiful. Now I'm going to be checking cranial nerve 11. So if you could for me, lift your shoulders up. Don't let me push down. Perfect. And now turn your head to the left. Try to turn your head back to the right. Good. Turn your head to the right. Try to turn back to the left. Good. Now we're going to be doing cranial nerve 12. So first, could you put your tongue in your mouth and push towards the cheek? Nice. Other cheek. Beautiful. And could you stick your tongue out for me? So if there was a cranial nerve 12 lesion, the tongue would deviate towards the side of the lesion. And I was also, could you stick your tongue out again? I'm also looking for any atrophy or fasciculations on the tongue. And that'd also be indicative of cranial nerve 12 lesion. And now I've just performed cranial nerves 1 through 12 examination.